welcome. This is True Leader, and the PhD philosopher at Loyola University, Maryland. And I'm here to talk about the chessboard of healing and a particular space on that chessboard I call anticipation. This is from my new book, The Healing Body, Creative Responses to Aging, Illness, and Affliction. And when I refer within that book and here to the chessboard of healing, I'm creating a metaphor where someone who is suffering with a chronic illness, injury, disability, the changes of aging, has quite a number of different options they can move to, strategies they can utilize to help them heal. In other words, existentially and emotionally, to become whole again, even if there's no medical cure for their bodily problem. And once again, today I'm going to talk about anticipating, because when we have some kind of an injury, illness, etc., it fractures and it changes our relationship to time, which is no longer kind of flowing smoothly, where we feel connected to the past and using the present to work toward our future goals and purposes. All of that can be thrown into question by a serious injury or illness. Today, I think I'll use a specific example of, let's say, a hiker who suddenly takes a bad step. The ground goes out from beneath them. They take a fall, they fracture their ankle, and it's going to be a while before the leg can heal fully and hiking resume. It could be months, could be years. And one of the ways in which such a person can deal with that is what I call anticipating, which is really focusing on the future. On a previous video, I talked about remembering, where we find meaning and consolation from the past. But it's pretty typical when dealing with injury or illness to put a focus on the future and have a kind of anticipatory hope that we will get better. And this hope can be a very good thing. It gives us energy for the rehabilitative processes. I imagine that hiker is going to need to undergo physical therapy and a whole series of exercises, which could be fatiguing and painful. So their anticipatory hope really keeps them going. And this is true as well for other diseases where, let's say, one has to undergo chemotherapy or radiation or surgery or dietary changes, etc. We need patience, from the Latin root, which means the quality of suffering or enduring. We really need to endure not only the illness itself, but also the accompanying medical intervention. So the anticipation of better days to come kind of keeps us going. It insulates us against despair. However, there are some shadow sides to anticipation. For one thing, this orientation toward the future is not always positive. My own mind tends to go toward what's called catastrophizing. What could be the worst possible outcomes that await me in the future? So obviously that negative anticipation causes a lot of anxiety, which often doesn't serve anything positive, and isn't even ultimately borne out. Things are not as bad as we anticipate. And another downside of anticipation is it really makes us overlook and devalue the present because we're so focused on the future. A philosophical psychiatrist, Eugene Minkowski, talked about the phenomenon of expectation, where instead of moving toward a desired future, he says, when stuck in expectation, we see the future come toward us. We wait for that future to become present. So in a certain way, we're paralyzed. We're trapped in passivity, just waiting, let's say, to see that specialist a month and a half from now, or even waiting for a new breakthrough in medical treatment that might come 5 years from now. But whatever it is that we're anticipating, uh, it creeps very slowly toward us. That specialist appointment that's a few weeks away might seem to take forever, to creep toward us very slowly. Um, Also, that anticipated cure, that anticipated breakthrough, the new diagnosis, the new surgery, whatever it is, doesn't always bring us the results that we hope for and imagine. There's a kind of fantasy construction of the power of medicine that patients and sometimes doctors as well buy into. That for every ill, there will be a pill. Um, and the outcome of all this anticipation of full restoration can be treatments that are very expensive, over treatments, treatments with painful side effects, uh, needless end of life suffering. So I guess I'll close by just saying anticipation is itself kind of like a medicine that has positive effects, but also potential negative side effects we have to watch out for. We need a real kind of dose of realism, and also a value of the present and what I am able to do currently, not simply the anticipation of some different and better future. So thanks very much and hope to see you soon again.